For decades, knee osteoarthritis has been misunderstood as simply a wear and tear disease of aging. Today, we're reimagining this condition through a revolutionary new lens that changes everything we thought we knew. The traditional medical view portrayed osteoarthritis as inevitable wear and tear from aging, focusing solely on cartilage breakdown. This oversimplified explanation suggested that joint use naturally leads to deterioration over time. This comparison shows what we thought was the whole story: healthy cartilage on the left gradually wearing down to the damaged cartilage on the right. But this view missed the bigger picture entirely. Modern research reveals osteoarthritis as a disease of the entire joint organ. It affects not just cartilage, but bone, ligaments, fat pads, synovium, and surrounding muscles. Every component plays a role in this complex condition. Osteoarthritis involves complex systemic factors that create destructive cycles throughout the body. Chronic inflammation, hormonal changes, gut microbiome imbalances, and genetic factors all contribute to joint deterioration in ways we never understood before. This complex disease process involves bone spurs, membrane inflammation, decreased joint space, and porous bone changes. Understanding these interconnected mechanisms opens new possibilities for treatment and prevention. This paradigm shift from wear and tear to systemic disease transforms how we understand, diagnose, and treat osteoarthritis. Join us as we explore the cutting-edge science behind this revolutionary new perspective. Traditional medicine viewed osteoarthritis as simply wear and tear of individual joints. However, modern research reveals a completely different picture. Osteoarthritis is actually a systemic disease affecting the entire body. The traditional view saw osteoarthritis as simple joint wear and tear, a localized problem caused by aging. But we now understand it as a complex systemic disease involving chronic inflammation throughout the body. Osteoarthritis involves chronic, low-grade systemic inflammation that spreads far beyond the affected joint. This inflammation impacts mental health, physical activity, sleep quality, energy levels, and even affects other body systems. The concept of systemic osteoarthritis emphasizes that individual factors like genetics, chronic inflammation levels, and lifestyle choices all contribute to the disease process. This personalized approach moves us away from the old one-size-fits-all thinking. Metabolic osteoarthritis, or MET-OA, is gaining recognition as a distinct form of the disease. It highlights how metabolic disturbances and metabolic syndrome directly contribute to joint inflammation and cartilage breakdown through systemic pathways. This detailed comparison shows how osteoarthritis affects the entire joint structure. Notice the inflammatory cells, degradation products, and vascular changes, all evidence of the systemic inflammatory process we've been discussing. Understanding osteoarthritis as a systemic disease fundamentally changes how we approach treatment. Rather than focusing solely on the affected joint, we must consider the whole person, their genetics, metabolism, inflammation levels, and lifestyle factors. This systemic perspective opens new pathways for more effective, personalized treatments. Women face a significantly higher risk of developing osteoarthritis, particularly after menopause. Understanding the hormonal factors behind this disparity reveals crucial insights into the disease mechanism. Estrogen, the primary female hormone, plays a crucial protective role in maintaining cartilage health and joint function. It acts through multiple pathways to preserve joint integrity and reduce inflammation. During menopause, estrogen levels drop dramatically, often by 70 to 80%. This sharp decline removes the protective barrier that has been safeguarding joint health for decades. The consequences of estrogen decline are severe. Cartilage breakdown accelerates, joint pain increases, and inflammatory cytokines flood the system. This creates a cascade of joint destruction. Hormone replacement therapy has shown promise in some studies for protecting joint health. However, the research remains mixed, with timing and duration of treatment being critical factors. Another important hormone is follicle-stimulating hormone, or FSH. Research suggests that elevated FSH levels during menopause may directly contribute to cartilage and bone degradation, independent of estrogen decline. Understanding these hormonal influences opens new therapeutic possibilities. By targeting both estrogen deficiency and FSH elevation, we may develop more effective treatments for preventing osteoarthritis in women. Inflammaging represents a revolutionary understanding of how chronic inflammation drives the aging process and contributes to osteoarthritis development. This chronic inflammatory state connects aging to multiple diseases including frailty, cardiovascular disease, neurodegeneration, muscle loss, diabetes, and osteoarthritis. Let's examine how muscle loss, or sarcopenia, demonstrates inflammaging in action. Healthy young muscle tissue contrasts sharply with aged muscle, showing significant deterioration. Dysfunctional fat tissue becomes a major source of inflammatory signals, affecting multiple organ systems throughout the body, including the liver, gut, brain, muscles, and pancreas. The triggers of inflammaging include oxidative stress, which damages cellular components through free radical attack on lipids, DNA, and proteins. Autophagy, the cellular cleanup process, becomes impaired with age. This leads to accumulation of damaged cellular components and increased inflammatory signaling. Complex immune cell interactions drive the inflammatory cascade. Multiple cell types, including macrophages, T cells, and neutrophils, contribute to chronic inflammation affecting joints and other tissues. In osteoarthritis, inflammaging creates a destructive cycle. Chronic systemic inflammation reaches joint tissues, breaking down cartilage, causing pain, and reducing quality of life through sustained tissue damage. Regenerative medicine for osteoarthritis represents a fundamental shift in how we approach joint healing. This is not simply about injecting stem cells into damaged areas. Modern regenerative medicine recognizes osteoarthritis as a disease affecting the entire joint organ. This includes not just cartilage, but bone, synovium, ligaments, and the surrounding tissues, working as an integrated system. The root cause is often systemic metabolic failure, not simply wear and tear. This understanding has revolutionized how we approach treatment, focusing on the underlying metabolic dysfunction. Platelet-rich plasma, or PRP therapy, exemplifies this new approach. PRP acts as biological signaling modulators, releasing anti-inflammatory cytokines and growth factors that recruit local repair cells. These therapies work by antagonizing catabolic pathways, the destructive processes that break down joint tissue. Instead, they promote anabolic pathways that build and repair tissue. The ultimate goal of regenerative medicine is reprogramming the inflamed metabolic environment and restoring homeostasis. This means bringing the joint back to its natural state of balance and health. Modern osteoarthritis diagnosis is evolving beyond traditional X-rays to embrace a comprehensive, personalized approach that considers the whole patient, not just the joint. Revolutionary biomarkers like microRNA 126(3p) are paving the way for simple blood tests that can detect osteoarthritis in its earliest stages, long before symptoms appear or joint damage becomes visible on imaging. The new holistic approach moves beyond X-rays to include comprehensive testing of inflammatory markers, metabolic health, and vitamin levels, providing a complete picture of the patient's condition. Metabolic markers like HbA1c and insulin levels reveal the connection between diabetes, metabolic syndrome, and osteoarthritis progression, helping doctors understand the systemic nature of the disease. Vitamin D deficiency is strongly linked to osteoarthritis progression and bone health. Testing vitamin D levels helps identify patients who may benefit from supplementation as part of their treatment plan. This comprehensive approach requires collaboration between multiple specialists. Rheumatologists work closely with endocrinologists to address metabolic factors, and nutritionists help optimize diet and gut health. Personalized medicine represents the future of osteoarthritis treatment. By analyzing individual biomarkers, genetic factors, and metabolic profiles, doctors can tailor interventions specifically to each patient's unique needs. The multimodal approach combines the best of all treatment modalities. This includes regenerative therapies, targeted medications, lifestyle modifications, and nutritional interventions, all working together to address osteoarthritis from multiple angles simultaneously. These diagnostic and therapeutic advances represent a fundamental shift toward precision medicine in osteoarthritis care, offering hope for better outcomes and improved quality of life for millions of patients worldwide. Leading experts in osteoarthritis are calling for a fundamental shift in how we approach this complex condition. The future of osteoarthritis care lies in holistic, personalized treatment that considers the whole person, not just the affected joint. Medical experts emphasize that osteoarthritis care must be individualized, taking into account each patient's unique genetic makeup, lifestyle factors, hormonal status, and overall health profile. Experts strongly advocate for maximizing non-surgical treatments before considering joint replacement surgery. Physical therapy, exercise programs, and weight management should be the foundation of osteoarthritis treatment. A multidisciplinary, patient-centered approach is essential for effective osteoarthritis management. This team includes physicians, physical therapists, nutritionists, pharmacists, and mental health professionals working together. Exciting emerging treatments include platelet-rich plasma therapy, stem cell-based treatments, and growth factor therapies. These regenerative approaches aim to repair and restore joint tissue rather than just managing symptoms. Experts emphasize that exercise and weight management are not just helpful additions to treatment, they are medicine. A comprehensive lifestyle approach, including anti-inflammatory nutrition and stress management, is fundamental to success. Experts caution against using catastrophizing language like bone on bone or wear and tear, which can increase patient fear and reduce activity. Instead, use empowering language that emphasizes the treatable nature of the condition. The future of osteoarthritis treatment is exciting and integrated. We're moving toward a comprehensive approach that treats the whole body, prevents disease progression, and uses cutting-edge technology to deliver personalized care that addresses root causes, not just symptoms.
Join our channel for more health info.